Okay, so let's get started. Again, thanks everybody for being here, particularly our presenters or sort of conversation leaders, I'll call it, because this is really sort of an informal session to relay, what resources are on our campus for all students, part-time, full-time, no matter what their health insurance looks like. And so we want to learn from you a little bit about what each of your offices does, and so that we can encourage more students to take advantage of the really important services that you're offering, particularly in these really, really upside down, difficult, stressful, scary, sad, unhealthy, you name it, times. So we have with us, I'm going to give you in order that I see you on my screen, Alan Sheffield, who's the director of the Office of Disability Services on campus. We have Christy Howley, who's the director of the VPVA on campus. That's the Office for Violence Prevention and Victim Assistance. And Barbara Stindler is the director of the Alcohol and Other Drug Assistance Program. He's also a clinician at the Counseling Center. So he's going to talk to you about both the ADAP program as well as the Counseling Center. So, I won't call on anyone. Doesn't need to be Socratic here tonight. Whoever wants to go first, just jump on in.
I mean, Alan, you were first.
Barbaros is representing two offices. So do you want to do them back to back, Barbaros, or do you want to start with one and then end with another?
And I'll just turn my seat around and be the other person.
That's up to you. Like, you want me to go ahead and go?
Go for it.
Okay. Well, good afternoon, everybody. I'm happy to be able to see. Well, let's see, Attila. Thank you for having your video on. It is nice, being brave enough to be the only one right now. But no, it's completely fine. We get it. It's a long day. It's like we're feeling a lot of the same things you all are, in many ways. So completely do what you need to do for you. So we're happy to be here. My name is Alan Sheffield, Director of Disability Services, as Dean Regina said. So my office is here for the express purpose of making sure that people with physical, mental, or medical conditions have the opportunity to be a student and address barriers that they may face and that may be coming up. So I picked those words very intentional. Physical, mental, or medical condition. That's the root of why people connect with our office. What they experience when they encounter a barrier that, because the world is not designed for an individual with those conditions, that's a disability. That's a disabling condition. And so that's when a person becomes a disabled person, not because of the condition they have, but because of the barriers and environment. So we're here to take a look at what is going on for a student. What are the accommodations or things that would be appropriate to address the barrier? And then communicate that out to the department, or in this case, to Dean Regina. That's different for every student. So when we talk about what is a disabling condition or could be, or what is a physical, mental, or medical condition, we're thinking about things like deafness, sensory conditions, so deaf, blind, mobility impairments, so things like limbs, conditions impacting limbs, using a wheelchair. We're looking at things like psychiatric conditions, so like a diagnosis of bipolar, dyslexia, or not dyslexia, sorry. It's been a long day and a long night last night. Like psychological conditions. So bipolar, depression, anxiety, schizophrenia. And then we have medical conditions like lupus, arthritis, things that are chronic conditions. And they have learning disabilities, dyslexia, dyscalculia, ADHD. Substance abuse would be something that we would work with in terms of it could be having an impact on the substance abuse recovery, I should say, to autism spectrum. So like really they say if it's a physical, medical, or mental condition that's impacting your ability to be a student, then we are the office that would most likely you should connect with, and you should reach out. We work directly with students, and so I'm a person that has had disabled conditions like my entire life. I have hearing loss since I've been an infant, and as an adult I've been diagnosed with ADHD and depression. So know that there's stigma involved, know that there's a lot of it's sometimes like forced intimacy to be contacting an office and sharing something that maybe you haven't been open about, and we get that. We're here partly also because so you don't have to share this with every other office on campus. We take that information, we hold it, and we only share what is absolutely necessary to be shared. And we work, thanks to Dean Regina this past, apparently what you shared during orientation, the law students, I think now make up the highest percentage of students connected with our office in terms of number compared to the number of total law students. So you're not alone. And so that's something to be aware of, because a lot of students come in. I'm sorry.
Speaking of percentage, might I just jump in? We're over 10% of our law school student body at the Newark location receives accommodations from your office.
Okay. Thank you for letting me know, because I was about to try to run that report.
Yeah.
So 20% of undergraduates nationwide identify as having a disability. The number, I think, is 11% of graduate students identify. So like those are nationwide numbers. And so like that's something that they're not alone. So like I say this because reach out, talk to us. It'd be an hour conversation. You fill out a registration form if you go to ods.newark.rutgers.edu. I'll put it in the link or put it in the chat. We will then follow up with you and set up an hour conversation. And from there, you can decide what happens. You drive this process. So I'm not going to let Dean Regina know that we met. If you're like, I'm not going to follow up and put anything in a permanent file. That actually doesn't happen. You graduate students who connect with our office graduate with the same degree. They do the same work. And so what we're doing is working to make sure that you are getting the support that is necessary in order to be the student that you are. And so that's the key thing that I think people sometimes forget or worry about. So if you have questions, if you have worries, I am the individual that works with law students in the office. And I'm happy to answer any questions that might have either here or offline. So I'm going to put it into the chat. I think I covered the things that you asked for our initial conversation.
Thank you. And I think I just want to also sort of reiterate the confidential nature of, Alan, you mentioned something about like nothing goes into a file. I don't even ever find out unless it's absolutely necessary for the type of accommodation being given, what the disability or the condition is that students have. That information is shared with me on a very, very limited basis, and only when I absolutely need to know it in order to implement an accommodation. So it never goes in a law school file. It never goes to the bar. Just want to reiterate that because I think that's another piece that deters students from coming to you. So thank you. Christy or Barbaros, did either one of you want to go next?
I'll hop on. Hi, everyone. I am Christy Howley. I am the director of the Office for VPVA, which is Violence Prevention Victim Assistance on the Rutgers Newark campus. So really, we're primarily responsible for working with, it sounds like from our title, victim assistance. It sounds like we only work with students who identify as victims, but we offer services to every student on the campus. So really what that looks like is we offer trauma-sensitive, trauma-informed care. We know that statistically 11.2% of students on a college campus will be experiencing sexual assault during an academic year, which is, it sounds crazy high, but I think it's because we have a very specific idea of what sexual assault is, sexual violence is. And when we actually look at it, it's something that is affected a lot of our students on campus housing, off campus housing. So really we work with students to do education on what is consent, what does that look like? How do you navigate the conversation around consent when you're in a relationship? How do you navigate the conversation when alcohol or substances are involved? So Barbarossa's office and I work very closely together a lot. Partner violence. A lot of students come to us because they're in a relationship that they don't really know if they feel safe in. They don't know what safety is supposed to look like in a relationship. They don't know what their options are. And a lot of times there's a stigma around being in an abusive relationship, right? So it's really, really hard to label something as abusive. We know that we come from a campus where there's this beautiful array of cultures that come, cultures and religions. And so families look different, relationships look different within all of those different cultures. And so, you know, it's a struggle to sometimes navigate what's expected of someone culturally or what might be acceptable in someone's culture or their home life, and then to come out into a campus or a westernized culture where there's different rules and there's different sets of expectations, and there's a struggle with, you know, how does what I grew up with differ from what I'm being told is now wrong or right, or what's being expected of me in a relationship. The great thing about our office is that it's completely confidential. What that means is that students that come to our office to even just talk, right? We're all remote now, but students can connect with us in a number of ways and can reach out and say, hey, listen, I am not sure if this is anything, right? I'm not sure. I just need to kind of vent. I need to talk. I need to maybe share a little bit of my story and see what resources or what options I have. And students can feel comfortable doing that safely because we are under no obligation to report anything that is shared with us, with law enforcement, with Title IX, with other members of the staff or faculty on our campus. And that's really huge because there's only a few departments. Barbaros will talk about the Counseling Center, which is another, and then student health services. So if students share something with us of a nature in which a violent incident occurred, we cannot share that information. So a lot of times students will come to us, and we do see a lot of law school students. You know, I think a lot of times people think that the services are restricted for undergrad students or are only for undergrad students. And I just want to make that really clear because a lot of times when the law school students come, and thanks to Dean Regina, she kind of gives them the open door, but they'll come and they'll say, I don't know if I can receive services here, or I don't know if there an office I can go to. And so I always like to let them know that, yes, you're in the right place, and the services are for all Rutgers Newark students, regardless of, you know, if you're undergrad, your grad school, your law school. You know, and there's no obligation to get clinical services. Some of the things that we offer are trauma-informed clinical therapy for those who really wish to begin processing, you know, their trauma. But we have students that say, hey, listen, I really just want to sit down and have a conversation about what happened, learn a little bit. Or maybe they say, hey, listen, nothing happened to me, but my partner shared something with me, or my roommate or a friend, and I don't really know how to handle it. You know, I don't know what to say. What is the right thing to say in the situation? Can I get a little bit of information? And then we do informational programming on campus about how to handle a disclosure. We train staff and faculty, which is really, really huge because we work closely with the care team, if you're familiar with them, a group on campus full of faculty and staff who navigate student concerns that are not just related to mental health, but might be academic or might be financial, or if they know of a student that has housing insecurity or food insecurity. But what we've learned is a lot of faculty and staff don't really have the tools to navigate a student disclosing to them. So let's say, for example, a student couldn't finish a midterm because they were having an altercation with their partner and it turned violent, and they don't want to tell friends or family, but they couldn't submit their midterm. they might be afraid to share it with their professor because they're afraid they're going to get judged, or maybe they're afraid that the professor isn't going to believe them or handle it well, right? And so this is something that students can come to our office and share with us, and we can work with other people on campus, the care team, really whoever the student would like us to connect with, because remember, it's all confidential. And so anything we do with that information has to have the student's approval. The student would say, yes, I'd like to do this, right? You would drive the car. You would say, hey, listen, here's what I'd like to do. Here's what I don't want to do. I don't want law enforcement contacted, and that's perfectly fine, right? And we can give you the resources. A lot of times we have students connect with our office once, they get some information, we don't really hear from them again for a few months, and that's perfectly fine. Maybe later on you decide, hey, listen, I feel like I really need some more support. And students are ready to come back, whether it's in a clinical capacity or they just want to kind of touch base again. And so I think, when they hear therapy, people think it's, hey, listen, I'm going to come and I'm going to be locked into once a week therapy. And that's really not the case for us. We do offer it, but a lot of our students really just use the service as kind of a touch base for support. And so some things that I mentioned to keep in mind are that it's confidential, that we have remote programming now, that we are virtual. And, it's a place to come for students who, regardless of whether or not you've had direct experience or impact with violence, it's a source of support. Now, especially, we're seeing students who have been impacted with a lot more than just sexual violence and partner violence, students that have experienced trauma in a whole lot of other facets because of, the environment that we're in right now in our country. Students are contacting us because they just need support, right? People are struggling. And mental health services are wonderful, but sometimes they just need a place to stop, get some support, get some tools, and that's what students can receive from us. I also want to note that we have a text-based service. So for students that either are not comfortable meeting via phone or via Zoom, or have something which they of course don't need to share, but inhibits them from wanting to talk either face-to-face, on the phone, via Zoom, and to keep that anonymity, we have trained student peer advocates who are trained in crisis intervention, who are trained in trauma-informed care, and it's all via text. So students can text the helpline. They will be connected with a student who's trained, a peer advocate, and they can just talk and they can get information and share resources. And that's anonymous and it's confidential. And so we will not have a record of who, right? We won't have a record of the student that wanted to reach out unless the student says, I'd really like follow-up from VPVA, or I'd really like follow-up from someone else. So it's just another resource to be able to connect students with another source of support that isn't necessarily a member of the staff or faculty, because we know sometimes students really like to connect with other students, but they also want to keep that that confidentiality. So I'm going to put some information in the chat. I'm going to put the link to our page on the Student Affairs site, but then I'm also going to put a couple of graphics if you want to save them to your desktop or just screenshot them to keep. It has the services that we offer, our contact information, and then information on the WeChat helpline, the text-based service I just mentioned.
Thank you so much, Christy. I'm not sure that I added a couple of things to Alan's, but I'm not sure I have anything to add, but I'm sure I'll think of a question or two. If anybody wants to jump in with a question at this point for either Alan or Christy about ODS or VPVA, you feel welcome to do that. Just unmute and ask. Okay, so Barbaros, your turn.
Thank you. My name is Barbaros Dindler. I am the director of the Alcohol and Other Drug Assistance Program, ADAP. I'm also the assistant director of the Counseling Center, and I oversee our collegiate recovery program at Rutgers Newark. Our offices provide psychological services to all registered matriculating students. That goes for undergrad, grad, and even professional studies. Our services are free and they're confidential. As Christy mentioned, none of the information that you share with us internally ever gets put on your academic profile. It's not shared with any other entity outside of the Counseling Center, unless there's a duty to warn such scenario. And usually we just contact the local services which usually on campus, it's RUPD and usually the local hospital. So students who want to connect to our office, all they have to do is call our number. Just like many of our offices, unfortunately, with the pandemic, we are operating fully remotely. So all you have to do is call the telephone number 973. I'll put it also in the chat, 973-353-5805. Our hours of operation are Monday through Friday, 8:30 to 5. After 5 p.m. it's a by appointment only. So students call, they provide some information. The administrative assistant who tackles that will then send a link to the students to do some pre-assessment questionnaires. Once that information is shared back with the admin assistant, the student then will be immediately given an intake evaluation appointment with one of the clinicians. I want to really make this distinction because a lot of students get confused. The intake therapist may be your primary therapist, or they may transfer you to someone who might be a better fit. So just be on the lookout for that. That session is really lasts about an hour long, sometimes shorter, sometimes longer, depending on the information. But we're really trying to collect as much background information in terms of what your needs are and what the presenting issues are regarding kind of psychological issues that you might be experiencing. We are also used by students to explore possibility of psychological issues. So you don't have to have a previous diagnosis. You don't have to even have previous experience of counseling. And we feel like we're seeing a lot more students experiencing or want to experience counseling because of what the pandemic has done to them, a lot of isolation, but also there's more flexibility with the pandemic and being virtual to connect with our office. I've been with the university a few days over 4 years, and I heard so many times from students that it took them about 5 to 10 tries to actually walk through our office and the doors because of stigma, because of potential backlash from a friend who might be walking by and having to answer those very difficult questions. Now you don't have any of that, which is very comforting that it's all done individually. And sometimes students, home situations or residence isn't also, conducive to their mental wellness or even their academic obligations. So a lot of things have transpired in students' lives. And this is an opportunity to explore with a licensed, experienced clinician about, what's going on and how we can assist. We do identify ourselves as short-term care. We don't necessarily assign a number to that because everyone's experience of it is different. So some folks actually will get better in 1 or 2 sessions, and some may need longer than that. We really work with the individual. We don't take any insurance. We have a psychiatrist on staff. So if there is a need for medication or a desire to explore medication as an option for any mental health concern, we have that capability currently. Again, medication is not required or mandatory to be involved in counseling services. We also offer a various amount of group therapy sessions, which can also help individuals connect with other students similar to them experiencing, similar concerns, let it be anxiety, depression. We have stress-related groups. We have a mindfulness meditation group that we operate, once a week. We're doing some specific programming for law students of color, first-year law students. And so we're exploring a lot of opportunity, particularly with the law school, just to really help ease some of those kind of fears and some concerns that are kind of happening, within the law school experience. So we're definitely accessible to you. I'm going to talk a little bit about the collegiate recovery program that I oversee. So this is a kind of a sub-program. This is an opportunity for students who are either in recovery, and what recovery means is a lifestyle change of abstinence. So someone is working a program of recovery and sobriety, and we don't make a distinction on what that program should look like or be like for an individual, as long as it's working for them. We have a growing number of students connecting with the community. So with myself and staff, but also with other students. And we have it actually right now, one of our largest subgroups within our recovery community is law students. So understanding that law school, there's a lot of pressure, there's a lot of events, especially when things were normal, going across the street and having drinks as a social gathering, as a way to distress, is definitely a part of the picture. So recovery law students are connecting with each other and other students supporting each other and making sure their recovery is intact, and in essence, making their academic obligations that much easier to tolerate. So there is no admission, there is no assessment for the recovery program. As long as you identify as someone seeking recovery or in recovery, you can connect with me. I'll share my I'll show the email address to the recovery program, so you can email that asking for more questions. And then we have all other students in the recovery program who have many years of continuous recovery, and so I could connect you with them to really explore what recovery looks like for individuals. So it does vary from person to person. So I'll stop there.
Thank you, Barbaros. And I should add that for both the Counseling Center and ADAP, well, and VPVA, I never know, and the law school never knows if a student seeks your services. Again, I think students are often deterred from going and seeking help because they think that this information might somehow end up with the bar via the law school somehow, and that is not true. That won't happen. I don't know, unless for some reason I need to be involved, which is very rare in in someone's sort of treatment, and they need to sign a release so that I can then speak with the Counseling Center. It's happened maybe once in the last 5 years. And again, there's no requirement that a release be signed. So I don't even know who is seeing therapists at the Counseling Center. I never know who goes to see Christy and her staff at VPVA. I only know that people receive accommodations from ODS because I need to implement those accommodations, but I know very little about the reasons behind that. So,
I can just self-disclose right away. I mean, I am currently treating 3 current law students ranging from 1L to 2L to all the way to 3L.
And I have no idea who they are.
And I think actually the 4th, 1 part-timer.
Okay. And I don't have the statistics on the Counseling Center in terms of how many of our students are seeing you, because I don't have a list. I don't have the names. That's a good thing. I wonder, well, first let me open it up to students. Does anybody have any questions about sort of generally what these offices do, or how to seek out their services and assistance? You don't have to raise your hand in the just unmute and ask. Okay, that's fine, because I have questions. So one, how can a student, how does a student know if they need your services? At what point does should a student sort of recognize certain signs or certain issues, either in themselves or maybe in a friend, that sort of should make them realize that they need a hand with this. They can't handle it on their own.
Is that for all of us or for Barbaros?
I think it probably applies to all of you. Yeah, it's for everybody. If everyone has an answer.
Yeah, I think that's a great question, and I think that definitely needs to be explored. What I refer to, in terms of kind of identifying one's own issues is really a baseline. And so if there are things where you're doing well and all of a sudden, you get into a little bit of a rut, maybe you're sleeping later, waking later, your energy isn't there, you're socially disconnected when you're normally socially more connected, even virtually, when appetite changes, when there's a pretty significant mood fluctuation, with substance use, if you would normally be kind of casually drinking, 1 or 2 beers a week, and now you're feeling like, oh wow, I'm starting a little bit earlier in the day, earlier in the week. I'm more hungover and more lethargic, and so I'm less kind of present in my life. And I think that goes for people that we know in our personal lives, because when we've known them, we've also have created a baseline for them. So if there's a friend that is normally very casual and joking, and all of a sudden they seem dark or distant or not as communicative, it's an opportunity for check-in with them. And also, it's not students' job to take care of other students. But you can say, hey, you look different, and there is this office that can help you. Explore that. And so that's what we really aim to do in the counseling center. We don't force anything upon any students. It really is just a safe and comfortable space, even virtually, to explore about what's going on. Also, for non-traditional students or traditional for students of different ethnic backgrounds where mental health is stigmatized or it's looked down upon, and not as serious as like a medical condition like diabetes or cancer. This can definitely impact, young people experiencing even today's world in the pandemic. And that's what this pandemic has really showed mental health clinicians, is that folks who are not even predisposed to any mental health conditions are experiencing symptomology that's, mimicking depression and anxiety. And so I think it's an opportunity to connect with our office, talk it out with a professional who can really tease out what you may be going through is something that's acute or something that's kind of chronic and long-term that maybe you've been battling with alone silently, and now you don't have to battle anymore. Depression isn't something that you kind of have to fight through. It might not ever go away completely, but it's an opportunity to be able to decrease the effects, the symptomology, so it doesn't get in the way of your functioning. And I think that's the way to look at kind of psychological barriers, is that the more that you remove, your life becomes easier and more manageable and enjoyable.
Yeah. So I'd like to piggyback off of Barbara's, if that's okay. So law school is hard. This shouldn't be a surprise to you all. Law school and COVID is considerably harder. There are things that happen in your life that can exacerbate what's going on for you, that can take you out of your comfort zone, like what you've set up for yourself, and challenge you. And there's nothing wrong with asking and saying, you know what, right this moment, I can use a little bit of support. There are times when we are the people supporting others, and there are times when we need that support. So we're seeing a huge increase and having a lot more conversations with students who just need a moment to have a conversation and to check in, and just because life right now is hard. So that's why we're here. My office, ODS, is not treatment providers. So we're not providing therapy. We're looking at, we have somebody who is potentially going through treatment or has a diagnosis, and what are the accommodations, what are the things that might be happening, maybe they're on medication that has side effects, and that causes symptoms that and things that need to be addressed in a testing environment. There are other effects, maybe impact the ability to kind of process information in real time. So looking at support for note taking. I did get a question privately, and say asking who do we work with and how do we support students. We will talk to somebody and figure out exactly what's going on and if there's impact, but we will often refer, we do work closely with VPVA. I think I've had Christy say that I'm one of the #1 referrers to her office, because we have an opportunity. Students come to us, and for 1 hour or more, they're talking with us because they know we're here to listen. And if there's something that maybe is not us, we will refer. We will connect you with the people who can help, and it may not be us. COVID is rough. And so that's something that we've had a large number of students who come to us and they've said, I thought I had this under control. I thought I didn't use any accommodations in undergrad. I get to law school between COVID and just something as simple for ADHD. Exercise is huge. Exercise can help mitigate the symptoms for people. And so losing the ability to exercise, now you're having exacerbated symptoms in an environment that's not conducive for education. Okay, so we're talking about accommodation specific to that. So that's I think the simple question, I may have gone off tangent, but was when do you connect with us? If it's impacting your ability to be a student, I say you should reach out. If you, right, it may not be us, it may not be my office, but we will connect you to the best of our ability to who it might be.
And
If you have used accommodations in the past, you should reach out. If you feel like you have used accommodations in the past, you're not using them now, but you plan to use them on the bar, you should know that the bar does look at past history of accommodation, and they can sometimes be difficult to work with at best. So those are kind of things that we have students who come to us, are approved for accommodations, opt not to use them because they're not needed in that circumstance, but are for the bar. And so that's the kind of thing that we can talk about. So that's why I say fill out the form. Oh, go ahead.
I was just going to
Sarah.
say that's an excellent point, and one that I would have forgotten to raise. I think that's very important. That the bar is going to want to see that students were accommodated in law school, and we do. We have a few students who have those accommodations in their back pocket and really don't even use all of them or any of them, but they need them on paper, right? So that if they want to use them later for the bar exam, they can. I lost my train of thought about another piece of what you said. It'll hit me later. But thank you.
Yeah.
Christy,
I'll
do
go
you have
ahead and
anything to
give
add?
Christy an opportunity.
I don't really have much to add. I mean, I think, you know, Alan had mentioned it's really from the academic front when it impacts your ability to be a student. And I think with our office, it goes a little bit further. So I mentioned the care team, and I work really closely with the care team because I have a lot of students who come and, you know, with the example I gave before of, I've had this situation that involved me in my life and maybe a traumatic incident that I experienced, whether it occurred recently or it occurred 15 years ago and I'm experiencing something relating to it now, but it's affecting my academics. We don't necessarily work with the academics, right? But our job is to look at it from the holistic person. How is this affecting you now? Because if it's affecting you, maybe not directly academically, you know, your primary role here at Rutgers is as a student. We know that. But you're also a person, right? The student piece of you is one piece of you at this university. But we know that there's, you know, you have your home life outside of this. You have a job, you have an internship, you have, you know, all these different pieces. And so if there's an incident of trauma or incidents of trauma, right, that affects you as a whole, which affects you being a student, which affects you being, you know, the person that you want to be. And so I think to answer the question of when do you access the services, it's if you feel like it's affecting you at all and not just academically, right? I mean, I think the great thing about Rutgers, and I don't just say this because I work here, is that there are so many services that are available to students. You know, and for the most part, the staff, the faculty are really well versed in what's available at the school and really tuned into who they can make a referral to. So, you know, if you go to one office, you're getting a referral, they're recognizing, hey, you have this need. You know, so I think when students interact with our office, there's a fear of, I don't want to be stigmatized. I'm not a victim. This isn't bothering me. I'm okay. But usually I find that when students ask the question, why is this still bothering me? It's because they haven't addressed it. And so once students kind of acknowledge, hey, listen, there's a place on campus or somewhere I can go to address this issue safely and confidentially, it kind of removes this fear, and then they can focus on the academics. They can focus on, you know, their internship and their job and whether or not they're a parent or their relationship. And so that's really what we try to provide to students, is this really safe space where they can come figure out this aspect of their life and be really successful in the rest of it. Because if they're not working through their trauma, they're going to be not as successful as they could be everywhere else.
Thank you all. I want to open it up. I see we're sort of closing in on 6 o'clock, and it's been a long day and a long week for everybody. And I know everyone is sort of zoomed out. I want to just open it up one last time just to make sure that our students have said anything they want to say or asked anything they want to ask. Anybody? That's fine if not. I also just want to genuinely thank the three of you, Christy, Barbaros, and Ellen, for joining us this evening. I'm really proud to work with all of you, and I'm thankful that you are on our campus so that I can refer students to all of you and put them in your capable and caring hands. So thanks for joining us. What I'm going to do is post this so that our students, all 750 of them, can check it out on their own time, because I think we just went over some really, really valuable information that they will all benefit from. So thank you to our students for coming. Pop into my office hours, come say hello. I miss you. And thank you to Christy and Barbaros and Alan for sharing with us and for being here tonight. We all really appreciate it.
Thank you for the invitation.
Good night, everybody.
Best wishes, students.
Thank you for organizing that.
Thank you.
Good night.
Sure. Bye.
Have a good night.
Bye.